Hello and welcome back to a very special episode of Taking Control of Cancer, the podcast brought to you by the North East London Cancer Alliance. I'm Steve Bland and happy World Cancer Day, everybody. This is a really big day in the calendar for anybody involved with cancer, and actually today is an even more important day because we're seeing the release of the government's new National Cancer Plan. Loads and loads and loads to talk about with my two guests. We've got Femi Adewale, who's the Managing Director of the North East London Cancer Alliance. Hello, Femi.
Hi, Steve. Hi, everyone.
And we've got Dr. Jagan John, who is a GP and also the Primary Care Board representative for the North East London ICB. Hello, Jagan. How are you doing?
Yeah, great. Hi, thank you for inviting me.
No, thanks for coming along on what is, I'm sure, a really busy day. Let me just... I want to read out a couple of things that I saw in the press release, actually, that came out on the National Cancer Plan. Just outlining where we are now, the NHS has not met its central cancer performance target that 85% of patients begin treatment within 62 days of referral since 2014. Survival rates are below Romania and Poland for some cancer types. Really, really difficult position that we find ourselves in. Really challenging, but under this plan, that will change. By March 2029, the NHS will meet all three cancer waiting time standards. 75% of patients diagnosed from 2035 will be cancer-free or living well after 5 years following record investment in the NHS. The plan is that we will become a global leader on cancer survival by 2035. And I love this little line in there from Wes Streeting, the Health Secretary. He says, cancer performance is a touchstone for the wider NHS, a tide on which all ships rise, and a litmus test for our mission to modernise the health service. If we get cancer right, we get healthcare right. And that's why transforming cancer outcomes is not just a priority for this government, it's a necessity. Who wants to kick us off? Because there's 86 pages of this National Cancer Plan. And I know you guys probably have had a little bit more time to digest it. I haven't been through all 86 pages. There's obviously so much in there, but Femi, maybe just kick us off with, what are the main themes?
Yeah, sure. I mean, I think Dr. John has read every single page and made notes against every single thing. But however, I will kickstart. I'll kickstart. No, only joking. But there are 6 core themes in this plan, and I think before I go into those themes, I think it's crucial to just mention that it is a very welcomed. I feel personally, it's a very great plan for the NHS, and it really does cover a number of things, particularly challenges across Northeast London. But we'll talk about that in a lot more detail, I guess, in a few moments. So there are 6 core themes. One is driving up NHS cancer performance. Another is becoming a global leader in cancer outcomes by 2035. I think that is a very bold statement, and it's very important to be as bold. It shows the seriousness as a country towards delivering cancer services. Designing cancer care around people's lives, that's important. We talk about this quite a lot, don't we, Steve, around personalized care as well. World-class cancer care through research. Again, another bold statement. Children and young people's cancer. Again, that's fundamentally important for us to really home in on this. And of course, there's another point, or another theme, which is rare and less common cancers. And again, something also important for our population as well. So, I mean, I can just take in the first point, for example. We all know the challenges that the country has had in delivering cancer services. 62 days as a country hasn't been met since forever. And, there are some challenges around that, not necessarily down to, hospital providers not wanting to deliver. There are various different factors associated with that. And I think we've covered this quite a bit, actually, in some of our discussions, haven't we, Steve?
Yeah.
However, it does really call out the country's position, and it does really commit to 3 core standards, delivering 80%. So, of course, delivering the standards by 2029, diagnosing all patients diagnosing all patients and ensuring that patients are diagnosed or cleared of cancer within the first 28 days of an urgent referral. And it's committing that 80% of patients on this pathway will meet this standard. The standard again for the 62-day is 85%, which is the old standard. And again, that's the standard that we significantly struggled with. So again, bold statements that we should be meeting those standards. And also the patients that start treatment within 31 days of the decision to treat, again, ensuring that 96% of the patients on that pathway meet those standards is crucially important. So it's kind of gone into that, and it talks about some of the expansion and productivity improvements in community diagnostic centers. It focuses on investments in AI and digital tools and new radiotherapy machinery, and there's a focus support for underperforming trusts and greater transparency in data. Again, the plan really does go into detail as to how and the steps required in order to start
Mm.
to make the great steps and strides in meeting these performance standards.
Yeah, it's
So
really interesting, isn't it? It's um, you sort of said you touched on then the challenge is the how, isn't it? You know, we can all come up with these really bold ideas and ambitions, and I love how bold it is. The targets are great, and we'll all make sure that we hold, you know, ourselves as a cancer system, you know, but also decision makers to account on those targets. That's really important too, isn't it? But it does come down to how we actually get there. That's the crucial thing. Jagan, um, what jumped out at you from reading all 86 pages?
I mean, for me, so I can't, reiterate what Femi has just said, but one thing I loved about the kind of cancer's plan or the strategy was that the fact that it's broken it down to what happens in real life, what happens to patients, accessibility, getting the tests, really understanding about red flag, what we call in the medical world a red flag symptoms, things that you should really go to your doctor about, and really talking about preventative stuff. So there's some in the cancer plan talks about genomic testing and inherited risk of cancer, which is really pushing hard. And then something about NHS app, which I thought was great. Those screening invitations. The ones that we really struggle as GPs. We send these appointments out to and of course the national team to come and go and get screened, go and get your breast screen, go and get your two tests, go and get this, go and get that. And in actual fact, it's handing the public, a little bit of responsibility in your own app to say, you know, actually, I can't make that time. I can, and I can rearrange it. And these are the things that happen, and then people get missed as well. Um, so for me, I think as Femi said, it really goes into the detail of where problems can happen, i.e., when does a resident or a patient or a person, where does it fall down, and where do people get missed going forward? So it's a broad plan which talks about public awareness as kind of almost fundamental, and talking about neighbourhood teams and talking about the way that we deliver care in terms of how getting people into the testing and getting them through the system. But actually the thing that really got to me was something about the quality of the care, and that talks about neighborhood teams. And if you've got cancer is here to stay, it's a fact. And this is what the government has really understood, to say, look, cancer is a fact. It's part of living. It's part of a part of the process. So let's get on top of it. Let's get a good quality experience. If you're living with cancer, how can we all together as professionals and working with the wider sector to really improve those lives and their families, because it can be devastating. It can completely destroy lives, financially, personally, and so on and so on. And one thing I loved about this, that they really thought about, well, how do we get to the quality stuff? How do we
Yeah,
improve, that quality, and get people in touch with what is out there? And the biggest issue that I see is that, even as professionals, we don't always know what's out there to help support our patients, our residents, and so on. So those are the kind of big highlight things for me going forward.
it's really interesting, isn't it, Femi? Because I think that I don't know if this is daunting or exciting or a mixture of both. But alliances were actually mentioned, an awful lot in this national cancer plan as being a really important way to deliver a lot of the plan, particularly around work with communities, particularly around work with maybe some of the parts of our communities that are typically a bit trickier to reach, that we haven't got right in terms of the inequalities that we've talked about loads of times on this podcast. Um, Action 19 in the plan said we will keep and strengthen the role of cancer alliances. So, how do you kind of read the role of alliances in what the government's planning, what the government wants to achieve?
I mean, we cancer alliances are going to be the alongside everybody that's involved in delivering cancer. Cancer alliances are going to be the transformational arm for delivering this. I think the thing about cancer alliances, as you know, is that we work across the system in its entirety. So we work with charities, we work with private healthcare providers, we work with AI companies, we work with hospitals, and absolutely everybody involved in the delivery of cancer, or anybody that could be involved with the improvement of pathways or different ways of working. We absolutely work across the system to support to doing that, and that also means, this our team is also made up of GP leads. It's made up of patient advocates. It's made up of providers themselves. So it's a combination of specific approaches that we can take as a cancer alliance for our population. So it allows us to work to deliver the plan localized for our population, the type of population that we have. So I think it's important. And again, you see in this plan actually the mention of some of the examples of the good practice and pilot projects, and targeted interventions that have been done in Northeast London is specifically called out in the plan. So, for example, the HPV self-sampling pilot, again, that was called out in the plan as well. There was, the cancer awareness and screening inequalities work that we've done. And there's various different things that were called out in this plan. Not that, for those who are reading the plan, you will see my little, our claim to fame in this plan. But it just shows the importance of working with and through cancer alliances to delivering specific projects, whilst providers and GPs are delivering care to patients at the time to which they need to deliver care. So I think this is absolutely powerful, kind of powerful. Is powerful the right word to use? Important for cancer
Yeah, it's
alliances.
powerful as well. Yeah, I guess empowering maybe rather than powerful.
Empowering. There you go.
It really puts cancer alliances at the center for all those reasons that you just talked about, at the center of, particularly the work around inequalities and making sure that we're getting to those communities that we know are not taking up screening appointments. We know they're not going to their mammograms. We know they're not returning their bowel cancer screening.
The
We
word
know
I
that
was
because
looking
we've talked
for,
about it so
yeah,
much.
the word I was looking for that didn't come out and I was struggling to get out is collaboration.
Yeah,
Cancer alliances are great at collaborative work within a system.
yeah,
And I think that's the key word. Don't want to go into blabbering again, but that's the real key word.
yeah.
And I think that's instrumental in delivering what this plan is asking for everybody to deliver.
Uh, Jacob, we've had cancer plans before, haven't we? We've had national cancer plans before, and I'm sure you chaps have worked in cancer, I'm sure, for a long time, or have been in and around the health service. We've had cancer plans before. Why was it so important to have one now? Is it given, the overall, the picture of where we are with cancer in this country? Why was it so important to have one now? And how do we make sure that this one actually sticks and we hit the targets that we're saying we're going to hit?
I think you're right. I think the trajectories. I mean, the United Kingdom was a world leader, and in some respects still a world leader in cancer care and cancer innovation. But you're right. I think it's a bit of a call for action, really, isn't it? This paper. It's saying, look, it's not enough. We're seeing more and more cancer than ever before. We're not hitting the targets than ever before. We're hearing stories of not great quality or experiences from our residents and patients. We've seen some data that shows in some areas and patches in northeast London that where we're getting late diagnosis of cancer, but late cancer diagnosis because they present very much later. Um, so I think it is now. Now is the time to do it, and I think 2035 is probably you're right. It's 10 years roughly, isn't it, that we could really turn the tide in a different way. And I do agree with Femi. At the point, Cancer Alliance. I've done a lot of work on health inequalities. We're doing these holistic pop-up clinics in Barking Dagenham where I work, and we've used Cancer Alliance as one of our partners to help promote and support that kind of cancer awareness. And what was really interesting when we collaborate with the Cancer Alliance with all our partners, and it's these holistic clinics have all our partners from charities to hospital trusts to voluntary sector groups and then GPs seeing people and even referring people with the Cancer Alliance there, and we're doing talks. The uptake of awareness is huge. We've seen massive increases. So I think really it's about reframing and readdressing the problem, which is let's get cancer diagnosed early, let's get treatment quickly, and let's get people living longer, fulfilling, a much more, quality life, going forward. So yeah, I think the answer to your question, you're right. It is now's the time to do it. It's a call to action. Let's really readdress these issues and use everything that we've got to throw at it. And I think that's what this is all about.
It is interesting, isn't it, that it talks, particularly in the kind of opening sections of the 86 pages. I haven't got, right down to page 86 yet, but I did read the first little bit. Wes Streeting's talking, and they're quite explicit and quite honest, aren't they? And in laying out the position that we're in, and it's just not good enough, is it? I mean, this is no, it's no personal criticism on anybody that's been involved or is involved in cancer care, because we know there are some wonderful, wonderful people doing an incredible job. But we're not good. We're not good at cancer, are we? And it feels like a real, a real kind of bold move. You said, 2035 is 10, 9 years away, 9 or 10 years away. It feels like a long way, but that will go in an instant, won't it? That is not in cancer world, in NHS world, that is not a long time. And I think it's going to take, isn't it, Femi, everybody working together right across the system, from patients, as Jagan says, there is an onus on patients, you know, patients right the way through to big, the very top decision makers to try and get this right.
Absolutely. But it goes back to your point that you made earlier on, which is the plan doesn't only essentially call out the challenges or make the statements, the bold statement. It also talks about the how. And I think
Yeah.
just in regards to, calling out the fact that actually we need to do better in the next 10 years. And given the 10 years, first of all, it's an achievable, it's a realistic, it's a bold, but a statement. However, real action and investment needs to be made. So again, you can see in the plan, it talks about the expansion of the screening programs. So it talks about lung, bowel, cervical, breast. It talks about the rollout of new technologies as well. We're not going to be able to just do this alone. You need to enhance screening. You need to detect people a lot earlier, and you need to then ensure that actually you have the right technologies in place as well. And again, it has to be targeted. And the plan also talks about targeted action to reduce inequalities in early diagnosis and survival. For us, as you know, that's major
That's
because
everything.
we've
Yeah.
got very
Massive
diverse
challenge.
population. Yeah.
Yeah.
And obviously, it also talks about the preparation for multi-cancer early detection tests, which is going to be crucial for our area and the type of diverse population that we have. So it goes back to the how, as you mentioned.
Mm.
It goes back to the how. It talks about the how, and I think that actually the fact that it does talk about the how and it does talk about the investments that are going to be made, and it does talk about the realistic methods or areas that we need to focus to deliver against, it makes it a very ambitious but very realistic plan to deliver against.
How do we keep tabs on this? Because presumably this big target for 2035 is it's a really ambitious target. We're not just going to check back in 2035 and say, have we got there?
Mm,
Are there going to be touch points along the way where we're going to be able to see if we're on track? Because I think that's a key thing, isn't it? To make sure that we're not just looking at 2035 as being a point we have to get to. We're
mm.
actually making these improvements as we go.
Good point. So, and I think that's where, I mean, the one thing that the NHS is great at doing is collecting data. So there are regular touch points throughout. So even cancer alliances for our whole system or for our whole, population area that we cover, we also have to report what progress has been made against a number of these kind of actions, really. So these ambitions will be turned into real life actions. They'll be localized, and cancer alliances, alongside providers, alongside deliverers of care, have to really commit to plans that state how they're going to do that. And on a quarterly basis, we're monitored against those plans. And then on a monthly basis, we obviously have the metrics to see how we're doing against each of these plans. Some of these are a lot more, they take a longer period of time. So, for example, reducing earlier diagnosis, by X amount is something that you monitor over time, but you'll see whether or not the interventions that are being taken are actually having some level of impact. But again, the answer to your question, sorry, it's quite long-winded, is that yes, there are touch points, and they're monitored all throughout.
We've got a health secretary, haven't we, who has been through cancer himself. We've got um, an undersecretary for state for public health and prevention, Ashley Dalton, who is currently undergoing treatment for her cancer. Do you think that that sort of lived experience makes a big difference, Jagan, when it comes to? I know they have to look at bigger picture, but that understanding, they talk about unashamedly putting the patients first. Do you think that lived experience that those two individuals, and probably more individuals within the Department of Health have? Do you think that's important?
I think obviously anyone going through cancer, of course, my heart goes out to them. It's a tough journey. But you're right, lived experience, and that's what the whole kind of approach with neighbourhoods, and getting people who've been through, who are representative. As Femi said, we're a diverse community in North East London. People who are representative of their communities who've been through cancer. It has a huge impact on influencing others from their communities to actually go and get tested and go and get checked. And we know, for example, things like prostate cancer in Afro-Caribbean men is much higher. We know there are certain groups of people who are at risk of cancer even further than they are. And so, yes, I think it's something about being, um, you know, that where people can identify as well, and also just be quite open about some of our communities that just don't like talking about cancer. It's almost like a something you talk behind closed door. And what we're seeing now as cancer awareness is becoming, from our fantastic Cancer Alliance, but just wider. Through public messaging, it's starting to have those open conversations, and they're getting to find out actually that person did have cancer, or their parents had cancer, or their relatives had cancer, or their children had cancer, and those conversations are starting to happen, and that's what we've got to do, and that's why it's a little bit more exciting in this plan, is that we're really saying let's have a dialogue about cancer in our communities, in our neighborhoods, and get that support that we do. And I think for us, that's the change. That's where we, I think, would like to see the change, where it's something that's discussed at schools, it's discussed at the workplace, it's discussed in employment, it's discussed in all sorts of forms, that it isn't just something that is a conversation between you and your GP, or you and your partner. It becomes
Yeah.
a conversation that messaging is getting over and over again, because um, I think that's what, and I think when you do go through cancer, your perspectives do change. Of course they do, because you understand the complexity and the difficulties of navigating a health system as well. And I think some of this, the cancer plan talks about how we, improve that navigation. Having a care coordinator, a named care coordinator at every neighbourhood for every patient with cancer. These are massive things that the rest of it sounds, abstract to a person, but when it comes to a person, it's that ability to contact, be accessible, and getting the support. So I think yes, the answer to the question is yes. I think it does make a difference for lived experience, and I certainly think it improves the way that we talk about this thing and the dialogue.
Let's go on to World Cancer Day and have a little bit more chat about that. I think your last kind of word on the plan. I really, with all my heart, hope that this is the moment that we can look back on in 10 years and we say this is when it started to change and started to get better. And I know it's going to evolve a little bit, isn't it? We shouldn't be beholden to every single word in this plan for the next 10 years. It's got to evolve and it's got to change and it's got to move with time. We're going to have challenges with a pandemic, which nobody could have foresaw, you know, foreseen, which for cancer was really damaging, wasn't it? So there's loads of challenges we're going to have. It's going to have to evolve, but I hope, as I say, this is the moment that we look back on in 10 years and we say this was when the line was drawn in the sand and we got a lot better at doing cancer in this country. And we're I hope on this podcast and the work that I do, the BBC work I do, I hope we're going to hold them to account, hold everyone to account as much as we can for for these targets, which are ambitious, but I would love it if we got there. So yeah, fantastic, fantastic news. Let's have a word on World Cancer Day, because I think it is a really important day to just think about, isn't it? For so many families, I guess, including mine, mine for a long time. Every single day was World Cancer Day. Your world is turned upside down by cancer in so many ways, and it feels like it sits. There'll be a lot of families feeling exactly like that right now. But it is a day when all eyes are on the cancer world. We get to shout from the rooftops about engagement programs and education programs and all this kind of thing, and possibly for a day people listen a bit more than maybe they would have done normally. Chaps, what does it mean to both of you guys to have a dedicated day like this, World Cancer Day?
Vitally important. I mean, this is why we've got this podcast, isn't it? It's to continuously talk about the importance of cancer, the myths, and everything to support people and to just keep talking about cancer. And I think to have a day dedicated to promoting the well, a day also used to promote the importance of the fight against cancer that the country has dedicated its resources to and its funding towards is vitally important. But also the great strides I think the country has also made in delivering cancer care, in earlier detection rates. Yes, we haven't, as a country, met all of the standards for the past few years, but there has been a number of investments. There's been a number of things that's been done to get to this plan, as a prime example,
Yeah.
where we can start to really turn that around as well. But it's the world is moving. Technology is being introduced every single day. The various different factors you mentioned, the pandemic that we had and various other factors. But it's important to point out that this is one of the biggest killers in the country, and it's changed from just being what it used to be called, which is the myth around being just an old person's disease.
Yeah.
We're seeing some changes around that. So I think it's important for everybody to be aware of cancer, its symptoms, its existence, but also the strides has been taken, and also what to do when they see certain symptoms as well.
The theme of World Cancer Day, Jagan, is united by unique, and I think that's a really interesting theme, isn't it? That I think that this is the way cancer care is going, isn't it? That we are focusing much more on the individual needs of a patient or a community or a group of people, be it geographical or whatever it might be. I know you've done lots of work in this area as well. It's something that Northeast London is has lots of challenges in this area, but is also doing plenty to address.
Yeah, I mean, as mentioned before, we're doing lots of things like these integrated pop-up clinics, but actually more fundamentally, we're actually embracing our diversity, understanding people a little bit more, and obviously the way they do things and the reason why they do things, and I think that's where it becomes that personalized, as Femi mentioned before. You're personalizing communities. You're actually saying, look, the one standard approach doesn't work for everyone. We've got to do things slightly differently, and I think one thing we've in my patch where I am, we have a large Afro-Caribbean population, and working with the Afro-Caribbean voluntary sector groups and leaders, we've not only celebrated the cultural things, but also their concerns and their worries, and kind of really understanding why they don't go for screening or what their reason. It might be simple things like, well, I'm working every time you turn, I'm working all hours of the sun. I don't get a chance to go, and the simple things, and we just make assumptions about our communities, and actually by working with our communities, obviously the World Cancer Day is a great way of kind of saying, look, have you thought about cancer? And the people who have had cancer, are we remembering them, those survivors, and embracing, their journey, and kind of really saying, look, what could we have done better, and what could we learn from your journey going forward? So I think for us, with the Cancer Alliance and the likes of Femi and his team, it's about really trying to think of a different approach that understands not just our communities in general, but also just understand people's lives and why they do things and what are their priorities. You know, when you do some of these pop-ups, you suddenly realize that actually the biggest priority is a house or getting warm heating or clothing. Cancer screening is way down the list, and you start to understand why people behave in certain ways. Unless we get to that conversation, we're
Yeah.
never going to get past that cancer. How do we improve the cancer screening and those targets that we're all trying to do? So it's about really trying to work with local people and local residents, and then trying to devise a plan that works with them rather than to them, if you know what I mean.
Yeah, and you're a GP yourself. What part do GPs? What part does primary care play in all this?
Well, it's massive, isn't it? I mean, let's be honest. We are in some respects the gatekeepers to the system as well. But that Femi mentioned some of the things. Some of the how innovation can sometimes change. That HPV. The sampling. Sometimes doing self-testing. By that simple thing changed the way that we screen people, simply because they didn't need to come to the GP to get that screened and those tests and swabs and things. So it's about really making it more accessible, and also it doesn't matter where you go in the system. If you've got a suspicion of cancer, you don't need to go back to the GP. It goes straight into the system, and whether it be hospital, whether it be in urgent treatment centre, and that's another thing that we've all got to just get on with it. It shouldn't be to the GPs. But yes, you're right. GPs have a huge role to play. They support people through their journey. They coordinate and work and collaborate with lots of different providers, and also with things like social prescribing and personalized, the care coordinators, and looking at wider, working with our fantastic Macmillan teams and so on and so on. We can then start really getting how we can support them holistically, not just about what medication they take and what symptoms they have and so on and so on. So and in some respects, from a personal point of view, you're, as a GP, you're giving a lot more back. It's not just about medications and things. It's that personal sense of the fact that you're really helping someone and really helping the family
Yeah.
through, which could be a very difficult time for them.
Femi, if we, let's say, if when we record this podcast in 5 years' time, when we're still recording this podcast in 5 years' time, be up to like episode 500 or something by then. We're chatting in February 2031. will look a bit different. I can't have lost any more hair, but in 5 years, what are we going to be celebrating? What are we've talked about some of the kind of the big milestone targets in this cancer plan, but what are we going to be? What would you hope that we're celebrating?
Well, I'd hope that we, for Northeast London, would be. I mean, we're currently meeting the standards now, the performance standards, and we have done for a while. I would be expecting that we would maintain and sustain the delivery of faster access for our patients on the pathway. I would hope that in 5 years' time, that would be able to shift the earlier diagnosis dial and start to get closer to the national ambition. And this is just for Northeast London. That is an area that there is a lot more work that we need to do for Northeast London. So I'd expect that in another 5 years' time, episode 590 something, we would be sitting here and would be saying that actually, we found this really, really challenging. We've now shifted that dial and we are either close or exceeding the ambition that we have for the country and also for locally. Because again, we localize some of these and we talk about how we're going to do that. I would also say, would love to say that because of our population's diversity and deprivation, I would love us to sit here and talk about how much we have now engaged far more with our communities, with our patients, with our society in increasing the knowledge and therefore earlier detection for the patients for this particular population, because we are the most diverse population in London. So if we're able to start to really, really lock in our engagement with our population, which we've been doing, but to be able to sit here and say, yes, this is what we've done, and we can
Yeah.
see the results in these kind of areas, that will be phenomenal.
Jagan, what's the one thing you would say to anybody listening who maybe one of somebody that works in cancer, a cancer professional who thinks I want to be a part of this change? Like how what is the onus on everybody in this system to make sure that we're all contributing and all kind of pushing in the same direction?
I think for me is don't give up. Carry on. There are a lot of supporters. We all know that this is the right thing to do. And I certainly think, get involved. The neighborhoods, we want to, for me, on the back of what Femi's, doing and are getting our standards, even better than ever before. But for me, it's about really having that clear dialogue at every community and neighborhood to say that we're very much involved with our cancer teams, right at the group level, right at the home level, right at the community level going forward. And I think there is a whole load of fantastic professionals out there, and I've learned through the Cancer Alliance and wider to say that actually, we don't use as a GP job in GP, we don't use the fantastic knowledge base of of these people who are the experts about how we can do things differently going forward. So for me, the answer to your question is keep striding, really push the boundaries even further. I mean, we've got people talking about cancer in barbers, while they're having a haircut, and they're talking about prostate cancer. We've had, women, women's groups who, in very diverse women's groups who are just talking about cancer just very openly, you know, getting that conversations in every part of the system, and actually the likes of Femi or Paul or some of our GP clinical leads or our consultant colleagues, getting them talking to our faith groups and our wider groups, and really starting that dialogue and getting that interest going forward. And I think the beautiful thing is when you empower the public and the residents to really get something going, it self perpetuates. That's something I learned going forward. They got more ideas that me and Femi could even come up with together in a room. So I think for me, that's what I would say is please be available to be used, because we want to use you. We really want to crack this problem.
And if your final kind of word on the people affected by cancer, the people living with cancer, people undergoing cancer treatment, people who are going to be diagnosed in the next 10 years, and we know there are going to be millions of them. What's the message to them? Is it just a real message of hope, saying it's going to get better?
Yes, not only that, and I know me and Femi, in a podcast you never get to say, but there is active research going on. There's so much research going on. What we think we know about cancer today, tomorrow it may be very different.
Yeah,
And what I'm trying to say, it is hope. It is about hope, and we will get through this together. And cancer is nothing to be afraid of. It's something we just get on and treat, and then you can get on with your lives. Let's get the earlier we get in and get sorted, the likelihood, the better you'll manage and you can carry on and go back to your lives. So for me, let's get treated, let's get screened early, let's get this, looked at together. And I think for me, 20, 30, Femi will tell you, 40, 50 years ago, cancer is a very different story now, and that's all because of a hard-working research. There's Northeast London has a huge amount of research for our universities and hospitals. Some world-leading trials that we've got even within our own patch. So the cancer treatments are changing every day. The way we deal with cancer is changing every day. Even the public awareness and things that we can do, and in the way that we test and the way we access tests and things like this. I think coming back to your 5-year question, Steve, it's going to be a very different story. In 5 years, in cancer, things move really quickly. So I think it's very hopeful. I think it's innovation, and I think we'll be seeing that people are living normal lives, even if they have had cancer.
Femi, final word to you. Where's the Femi positivity dial? Is it turned right up? Are we feeling chipper about this plan, and also where we're heading?
I think from my enthusiasm from the beginning, it's I think it's definitely um well, mine is definitely up. I mean, mine is definitely a supporter of this. I think it makes sense. Personally, working all of these years in terms of, delivering plans and working with clinicians, these are some of the areas that clinicians are talking about. These are some of the areas that patients are talking about. Is captured in this plan. It's realistic. It covers challenges. It talks about the how. It empowers systems. It empowers cancer alliances. It empowers clinicians. I think there is, and it's the how that we spoke about. So I think I'm quite optimistic about this plan. But as Dr. John mentioned earlier, cancer is changing. Everything changes. So therefore, between now and then, it's important to have a plan that's innovative and that would allow us to adapt based on the changes that are occurring. And I think this kind of covers that.
Yeah, I totally agree. Listen, both of you, thank you so much. I know you've probably got all kinds of meetings. I know, Femi, you've got meetings this afternoon to go through all kinds of strategy stuff. I know you've got a lot to do to plan on how to implement this plan and how to support it in the best way that you can for the Alliance. So I'll let you guys go off and do all your wonderful, important work. Thank you so much for joining me.
Thank you, Steve.
Thank you, Steve.